invite Dr. Ajay Purohit. He'll be speaking on role of OCTA in retinal vascular disorders and optic nerve head diseases. Dr. Ajay Purohit is a senior consultant at Center for Sight, Jodhpur, and he is among us the first person who showed interest in OCTA and has a very great knowledge about the machine.
Thank you. Thank you, Avninder sir, for giving me this opportunity. Today I'll be discussing role of OCTA in retinal vascular disorders and ONH disease. See, the topics I'll be covering is the branch vein occlusion, CRVOs and CRAOs, and PAM also I'll be discussing here. So we all know the features of BRVO, and whoever is practicing retina, we all know that BRVO and CRVO are the cases where a patient will require a very long-term follow-up, and patient will keep coming back to you. He or she might require multiple anti-VEGF, PRP sittings, and so we are not going to the clinical details. And what OCTA does in BRVO is that it will help you demarcate the OCTA, the vascular boundaries, and show presence of macular ischemia also. So these patients will complain of not a good vision, or the quality of vision is not good. That's with the macular ischemia which is there. And in due course, these BRVOs might develop neovascular patch also. And so what OCTA does, it can show you both the superficial and the deep layers. And if you want to do a sectoral PRP, OCTA will help you very well demarcate the areas of non-perfused. So this was a case around a 55-year-old male who came to us with a diagnosis of PVD-induced vitreous hemorrhage. So it was not a PVD-induced, so we see here. We see what we saw here on OCTA was a superior non-perfused area which was there, and there was NVE patches which were there, and these patches were the reason for the vitreous hemorrhage. It was not a, so this patient was advised to undergo anti-VEGF injection and followed by a sectoral PRP. It was case 2. We'll show how OCTA helped this patient. This is a 74-year-old male patient, hypertensive patient, who came to us with a history of scotoma in his right eye. You see this? This is a small branch vein occlusion which has happened in this patient, and this is what the scotoma was because. But what happened was he was complaining with the decreased vision in the left eye too from past 1 year. So we scanned the left eye also, and this is what we saw. There was a macular ischemia which has developed, and you can see on OCTA also there is a GCC and RNFL loss corresponding to a presence of an old BRVO. So we did a 8x8 montage of this patient, left eye of this patient, and you can see there was a huge area of non-perfusion. Superior temporal area was completely non-perfused, and there was an area of macular ischemia. So this patient was advised to undergo only sectoral PRP, and the other eye was kept under observation because there was no macular edema. This was a case 3 of a hypertensive female patient who came to us with macular edema and BRVO. We see this is a 6x6 montage image of this patient, and you see inferiorly there's an infratemporal branch vein occlusion, and there was area of there are multiple areas non-perfused. You can see the superficial area which is they are non-perfused. The patient was advised PRP, but she refused, and she's still under follow-up. So this case will help you to understand the role of OCTA in follow-up of BRVO patient. She was she didn't have any medical history, but she did present to us with a BRVO. On OCTA, what we saw was there was inferior-temporal branch vein occlusion. And you see this area, this was an area of NVE, and what we saw on ONFAS was this small patch of NVE. And we see the deep layer, what Dr. Avninder sir has taught about the ONFAS image. This is the ONFAS of the deep layer. You can clearly see the inferior layer and the superior ONFAS image. This the inferior temporal area shows presence of ischemia in the deeper layers also. So she had an area of macular ischemia also, and this was you see here, these are the vessels, IRMA developing here. And she was advised to undergo anti-VEGF injections, and she did undergo multiple sittings of PRP. She came back to us after 2 years, and what we see after 2 years, we repeated her OCTA, and what we saw was that a small NVE patch has increased now, and there are areas of vitreous hemorrhage which has occurred here, and there are more patches of NVEs which are developing. Here, it was a single patch here. Now there are multiple patches of NVE developing. So again, she was advised to undergo anti-VEGF and PRP augmentation, but she refused this time, and she came back to us after 1 year. So after 1 year, we again did a serial OCTA, and what we saw was the NVE patches are still going up. there was this bunch of NVE, there are multiple areas of NVE. This time again she was advised a PRP and PRP augmentation and anti-VEGF. This time she did undergo an anti-VEGF and PRP, and this is how you can see the NVEs have regressed. This patch has gone down, these patches have also gone down. You see these very thinned out patches which are there, and this blob is also gone, but still the macular ischemia is still there. And what we saw here was, in the previous year, there was this thing which was developed. This was an ERM which was developing in this patient in due course of time. So on presentation, what we saw was this only macular ischemia, and after 3 years, what we saw was the presence of ERM also, which you can see on an on-fast image. And this is how an OCT angio has helped us to do a long-term follow-up of such patient. PAM is another entity which is a very, maybe a rare diagnosis and is only diagnosed on OCT and spectral domain OCT. There's a retinal capillary ischemia and the deeper layers are involved. The outer layer is not involved, but the middle retinal layer is involved. Sometimes it could be an isolated disease, and sometimes it could be considered a precursor of undergoing retinal vascular disorders. So what we see is the hyperreflective bands in the inner nuclear layers, but the outer retina is completely spread. So this was a hypertensive male, 54-year-old, and he presented to us with a history of diminished vision, but he was not able to explain. Vision was around 6/12, and this is what we saw. We see these patches, whitish patch, which are there on the OCT angio. These whitish lesions, they denote capillary ischemia. And what we saw on SD-OCT was these hyperreflective bands. This is a normal retina, and these are the hyperreflective bands present in the inner nuclear layer. So this confirmed our diagnosis of PAM. And again, what only OCT angio does is the deep layer we see. You see the superficial layer is near about normal, but what you saw on the deeper layers was the ischemic deeper layer, which is again a confirmatory of PAM. And another is CRAO, and which on presentation it does involve inner retinal layers and edema of the layer. And okay, so this is a patient who presented to us with CRAO on the left eye. And what he did an OCTA of both the eye. You see the right eye is near about normal. The peripapillary angiograph is normal. The left eye, you can see these capillary dropout areas, the extensive capillary dropout areas. And this patient developed an MI 1 week after CRAO. And he came back to us 1 month post CRAO. There is recanalization of vessels, so we can see on presentation and after 1 month, these small capillaries, they have opened, but still the density of capillary has actually gone down. And OCTA does help in glaucoma also. This is what a normal OCTA peripapillary nuclear ONH OCTA looks like. And we all know OCTA, we have a V-shaped defect in glaucomas, which are the capillary ischemic areas. And this is a young female patient with glaucoma. On presentation, there was this V-shaped defect, and this corresponds to capillary dropout areas on OCTA also. And after 3 years, when we again imaged her, the V-shaped defect is actually widened, and the capillary non-pressure actually increased. The pressures are well controlled, but she's still developing the V-shaped defect is still increasing. Thank you.
Thank you, Ajay. One thing what also we can diagnose is anti-ischemic optic neuropathy. We can, seeing the vascular pattern at the optic nerve head, it gives very good images of anti-ischemic optic neuropathy.